All right, so there's something happening to your future profession, and it has to do with how much you're gonna get paid. But nobody really takes the time to tell you guys, the pre-PTs, this. So we're gonna do it. Pre-PT Grind's gonna do it. So tune in if you wanna know what's going on with your future money.
Yeah, it's one shot, now the future is yours. Go! I'm turning dreams into reality. In the lab with the...
So let me put you up on some game about what's happening to your profession. All right, so the government is paying PTs, physical therapists, and physical therapist assistants less for their services. Oh my gosh, what do I do? Well, chill out, I'll explain it all in a second. So there's something called a physician fee schedule. Now you can Google this, you can look it up, we'll put a description below, or you guys know how to work the internet, just look it up. And it basically shows different healthcare providers how much the government is going to pay that healthcare provider for their services, okay? So this physician fee schedule has been going on since like the 90s. So this is not a new problem. If you click this button and you're afraid and you're like, oh my gosh, I should run to another profession, PT is gonna crumble, like, this has been going on since before you even thought of PT. So don't be freaked out too much. However, with this physician fee schedule, recently there's been some cuts in the making from the government saying that they want to pay physical therapists 9% less and physical therapist assistants 15% less, okay? So the government services that are being paid out to physical therapists, PTAs, and other healthcare professionals are really only three groups. These aren't all insurances, they're only three groups. So Medicare, Medicaid, and TRICARE. And TRICARE is like the military and veterans, okay? So the patients who you may be seeing, if they fall into these three groups, these are the only groups we're talking about right now. So if you're a PT or a PTA and you're thinking about going into those routes and you see patients from those populations, that's what we're talking about. If they have another commercial insurance or something else like that, it's not affecting them yet, okay, yet, all right? So that's the big news and that's where it's coming from. However, the interesting thing that I found with all of this is that it's just not happening to us. And us, I mean physical therapists and physical therapist assistants. It's happening to so many other healthcare professionals. And I'll put some links below. Maybe we could put a picture up here as well. I'll make sure that the links are there and so you can see them. But there's a number of healthcare professionals who are getting paid less. Okay, you'll see it on the screen. You'll see it when you click the link. They're getting paid less. And some healthcare professionals are getting bigger cuts than physical therapists and PTAs. But on the flip side, other healthcare professionals are getting paid more. All right, they're getting an increase in their reimbursement for their services from the government if they see patients who are Medicare, Medicaid, or TRICARE. All right, so keep that in mind. So it really tells me that there's really just a budgeting thing that's going on. It's just a rebalancing of money. So the money really isn't going anywhere, it's just being rebalanced. So why? What's their criteria? So what I found through some of my research, it might not be all the research that's out there, so if you guys find more, put it in the comments below. But what I found is that the professions doing more evaluations and management are getting paid more. And the professions that are doing more procedures are getting paid less. Why? Hey, ask the government. I don't really know, okay? But now you might be asking, well, physical therapists, you guys do evaluations and you manage stuff, right? Like manage the patient's care. You guys talk about that all the time. Well, yes, I do agree. However, the way our other billing codes are set up with our other interventions, the government might be seeing that as more like procedural codes. Okay, we might be billing those more as procedures, and that's why we might be getting paid less. Or in the government's perspective, they want to cut what they're being or what they're paying us in the future. Okay, so the good news is that for this year, the year that I'm making this video, still 2021, because of the advocacy of the APTA, our American Physical Therapists Association, that has been reduced. That 9% cut that was proposed has been reduced to only 3.6% for this year. So congratulations, we did our job so far, and kind of thing. All right, now it still got cut a little bit, but hey, it's better than the 9%. However, that can still go back up to the 9% that I mentioned before in 2022, and that 15% cut for PTAs is still on the table for that 15% cut. All right, so why this is important also is because of that commercial insurance that I talked about. The commercial insurance is out there, and that's why it's so scary, and people are freaking out like, oh my gosh, what's gonna happen? Oh my gosh, this is happening again. Is because if the government starts cutting these reimbursement rates, then the commercial insurances sometimes usually follow the government. So if you got your Blue Cross Blue Shield, your Aetna, your Humana, your Cigna, all that stuff, they might follow the government and be like, oh, they're doing that, I guess we got to do it as well. All right, so that's why it gets a little scary. So why we need to reverse it is because once we get paid more from either the government, cash pay, commercial insurances, all that stuff, then we have more money to be paid with. All right, so if you're looking at these PT salaries and you watch some of my other videos about why PTs are paid this much or paid this little or paid that much or whatever, well, it starts from a foundation of things like this. Where's the money gonna come from to pay us more? If we were getting a 9% increase reimbursement from the government, or a 15% increase, or so on and so forth, then the companies we work for, or ourselves, if we choose to take insurance from patients, have more money to pay us with, okay? So that's what we need to keep in mind when advocating for ourselves and reaching out to other patients and marketing ourselves in the future to make this trend go in the reverse pattern, okay? So a little break from all of that real quick so you guys can just absorb that, take that in, and kind of maybe keep in mind what I just said. So what I want you guys to keep in mind is that this can all help you stand out. We get questions all the time. That's our biggest question. How do we stand out? How do I stand out? I'm in this situation. I'm in that situation. How do I get into PT school? How do I look different? Well, if you took in any type of information from this video, if you did any type of research from anything that I put below or anything that I talked about, you are now on a different level than the other pre-PTs out there who don't even know this problem exists. If you go into a campus visit, virtual interview, regular interview, an email conversation, whatever that is, talking about a current event, a hot topic, a problem like this, it's game over. Because no other pre-PTs are really at this level. All they're asking about, do you take my GPA? Do you take my GRE? Oh my gosh, I'm in this situation. Can I still get in? And you're talking about higher level issues and topics and current events like this, you're on a totally different level. So how do you stand out? This is just another gem that's being dropped within our content that you can use to stand out. All right, so back to our regular scheduled video topic for this. So what do we do about this? Why is this important to get ahead of? Well, first, because it's your profession. This is your future paycheck. This is your money that we're talking about. So what we need to do is, number one, you need to Google physical therapy advocacy, or Google physical therapy Medicare Cuts, or Google physical therapy advocacy network. Google any of that stuff. You guys know how to work the internet, and it will pop up. It'll pop up for you. So once you do that, put your name on an email list, sign up for the newsletter so that you can get reminders and updates as to what's happening with this problem. So that when they tell you, hey, email your governor or your representative in your state and, you know, fill out this form and send it over. Now we have more people filling out those forms and sending in information and sending in petitions on physical therapists and PTA's behalf, so that they know, oh shoot, there's 200,000, a million, 50,000, however many people advocating for this problem to be fixed and to be solved on their behalf. And now those numbers tell your government officials how much or how important this should be to them. Okay, so get your name on those email lists, get the updates, stay informed, and take action for when that information is given. That's number one. Number two is promote your own future profession. If you're like, shoot, I want to get into physical therapy school, I want to be a sports PT, I want to be this PT, I want to do this, well, hey, it's your profession, you're taking ownership, well, time to take some more ownership. All right, start marketing out to patients, start posting stuff on your Instagram, start educating on your TikTok. I don't care what it is. Start informing your friends and family. Just start marketing out how physical therapy can help other people solve their problems that they have. Because if you can help other people solve a big enough problem with the tools that you'll be learning in physical therapy, the thing is, you might not even have to use this insurance thing. They might have a problem big enough that you can solve where you can just be like, hey, I don't even take your insurance. I charge cash. And the fact that you can solve their problem in a big enough way for them, they might be like, okay, here's the cash. And you don't even have to worry about anything that I talked about. It's game over if you can do that second part effectively. But how can you do it effectively? You got to start practicing now. How does Apple get your attention? How does Microsoft get your attention? How does Pre-PT Grind get your attention? How does your favorite YouTuber get your attention? Well, you got to start dissecting that marketing or dissecting that, practicing that marketing tactic and those marketing skills, and start practicing to use them on other people so that they come to you for their problem. Because people are going to get injured. People are going to get, strokes. People are going to be in bad health, right? These problems that physical therapy solves aren't going anywhere. The big question for you guys is, are you going to be the top of mind solution for these people's problems? If you are, you got nothing to worry about. If you're not, then this is where the anxiety comes in. This is where the fear comes in. Like, oh my gosh, what's going to happen to PT? Oh my God. If you're top of mind, if you're that Apple computer, if you're that Google search, if you're that whatever, then problem solved. We have nothing to worry about here. But since you guys are the future of the profession, we got to start doing that number 2, that marketing, that promoting now. All right. So with this whole, oh my gosh, the government is paying PTs less, Medicare cuts, physician fee schedules, PTAs getting paid less. This is the education and the information that you guys need to start with. But more importantly, this is the action that you need to take now. So I hope you guys got some information, some education from this video to get you off to a good start, so that if this comes up in conversation from other people, you guys aren't too scared and taken aback like, oh my gosh, what is this? I don't know what this means. Is PT doomed? Should I pick another profession? You now have a solid base, a solid introduction as to what all this means, so you can make an informed decision as to where you want your career to go and how you can make this career better if you choose to do PT. So, hope you guys got some good info from this. Like, subscribe, comment, share, and we'll see you on the next video.